ETO-50 and ETO-od with the generic name Itopride Hydrochloride are both formulated as tablets. ETO-50 contains 50 milligrams of the active ingredient per tablet, while the potency of ETO-od is likely adjusted for once-daily dosing. The SKUs for the brand include ETO-50 and ETO-od. The slogan for the brand is ETO Dual Action for Complete Digestive Ease. The brand is marketed and manufactured by MCOLSON Research Laboratories, PPT Limited. The primary difference between ETO-50 and ETO-od is their dosing frequency. ETO-50 may require multiple doses throughout the day, whereas ETO-od is designed for once-daily dosing. Studies acute and chronic stress can elevate GERD symptoms, contributing to more frequent acid reflux and discomfort. 66% of people experience work-life imbalance, which can elevate the risk of stress, anxiety, and depression, which in turn can exacerbate digestive issues like GERD. A novel Prokinetic with dual action to promote improved digestive motility. Does not pass the blood-brain barrier, which reduces the likelihood of central nervous system side effects. Does not affect heart rate, making it safer for long-term use, particularly in patients with heart-related concerns. Once-daily Prokinetic formulation with advanced matrix tablet technology for efficient drug delivery. Ensures round-the-clock gut motility, helping to maintain consistent digestive function throughout the day and night. Regulates gastric emptying times in conditions such as GERD, NERD, functional dyspepsia, and gastroparesis. Synergizes the effect of PPI, proton pump inhibitor, when taken in combination, enhancing the effectiveness of acid-suppressing therapies. Indications: GERD, gastroesophageal reflux disease. GERD is a chronic condition where stomach acid or bile irritates the food pipelining, leading to symptoms like heartburn, regurgitation, chest pain, and difficulty swallowing. It occurs when the lower esophageal sphincter, LES, weakens or relaxes inappropriately, allowing stomach contents to flow back into the esophagus. NERD, Non-Erosive Reflux Disease. NERD is a subset of GERD where patients experience symptoms like heartburn and regurgitation, but without visible damage to the esophagus, no erosions. It is often diagnosed when a patient exhibits GERD-like symptoms, but endoscopic examination shows no erosion or inflammation in the esophagus. Functional dyspepsia. Functional dyspepsia refers to persistent upper abdominal discomfort or pain, often associated with bloating, early satiety, and nausea, without any underlying structural abnormalities or disease. It is a common cause of indigestion that affects a significant portion of the population. Gastroparesis. Gastroparesis is a condition where the stomach empties more slowly than normal, leading to symptoms like nausea, vomiting, bloating, and a feeling of fullness after eating a small amount of food. It is often associated with conditions like diabetes or after surgery, where the vagus nerve, which controls stomach movement, is damaged. Mode of action inhibits acetylcholinesterase. Acetylcholinesterase is an enzyme that breaks down acetylcholine, a neurotransmitter responsible for stimulating muscle contraction in the gastrointestinal GI tract. By inhibiting this enzyme, Itopride hydrochloride increases acetylcholine availability, enhancing smooth muscle contractions in the stomach and intestines. This improves gut motility, facilitating better gastric emptying and reducing symptoms of indigestion and bloating. Blocks dopamine. D2 receptors. Dopamine is a neurotransmitter that can inhibit GI motility by binding to D2 receptors in the gastrointestinal tract. By blocking these receptors, Itopride hydrochloride enhances the contractile activity of the stomach and intestines, promoting faster gastric emptying and relieving symptoms such as nausea and bloating. This dual mechanism, acetylcholinesterase inhibition and dopamine receptor blockade, provides comprehensive support for GI motility. Features and benefits. Dual mode of action. Itopride. Hydrochloride works through two mechanisms, inhibiting acetylcholinesterase and blocking dopamine, D2 receptors. This dual action enhances gastrointestinal motility and reduces symptoms like bloating, nausea, and indigestion. Does not pass the blood-brain barrier. By not crossing the blood-brain barrier, it reduces the risk of central nervous system side effects like dizziness or sedation, making it safer for prolonged use. Does not affect heart rate. Unlike some other prokinetics, Itopride does not have an impact on the heart rate, ensuring the medication is suitable for long-term use, especially in patients with cardiovascular concerns. Once daily Prokinetic ETO-od formulation offers the convenience of once daily dosing, which is easier for patients to adhere to compared to multiple daily doses. Ensures round-the-clock gut motility. The advanced matrix tablet technology provides sustained release of the medication, ensuring continuous prokinetic action and consistent improvement in gastric motility throughout the day. Regulates gastric emptying times in GERD, NERD, functional dyspepsia, and gastroparesis. By enhancing gastric emptying, it alleviates symptoms of bloating, fullness, and discomfort often experienced in these conditions. Synergizes the effect of PPI. When taken alongside proton pump inhibitors, Itopride Hydrochloride enhances their effect, providing better control of GERD symptoms and improving overall treatment efficacy. Dose: adult dose, 50 milligrams taken 3 times daily before meals. This dosing regimen is typical for conditions like GERD, NERD, and functional dyspepsia, providing consistent prokinetic action to help with gastric motility and acid reflux symptoms. Once daily dosing for ETO-od. The dose may be adjusted to a tablet taken once daily for convenience, especially for patients who prefer fewer doses. This once daily formulation, like ETO-od, is likely designed to provide 24-hour symptom relief by ensuring consistent gut motility.